Wednesday was not only the inauguration of a new president, it was the second deadliest day in the coronavirus pandemic so far. As President Joe Biden begins his first full day in office, COVID-19 is at the top of the agenda. ABC's Alex Prescia is at the Capitol now with the latest.
President Joe Biden spending his first full day in office focused on tackling the health and economic challenges caused by the coronavirus pandemic.
Our national strategy is comprehensive. It's based on science, not politics. It's based on truth, not denial, and it's detailed.
Biden signing 10 executive actions, including triggering the Defense Production Act to make COVID-19 supplies, requiring masks at airports, and requiring international travelers show proof of a negative COVID test before arriving stateside. He also aims to establish a testing board. These plans come on the heels of Biden having the U.S. rejoin the World Health Organization.
I know these bold, practical steps will not come cheaply, but failing to do so will cost us so much more dearly.
Meanwhile, in the new democratically controlled Senate,
the first order of business is to advise and consent on the president's appointments to his cabinet.
So far, only one member of Biden's cabinet, his choice to be the Director of National Intelligence, has received Senate confirmation. The Republican minority leader seizing on Biden's invitation for unity.
So our side is ready to share ideas and work with the Biden administration.
President Biden will need cooperation from Republicans in the House and Senate going forward, especially for initiatives like his massive $1.9 trillion economic rescue package. Democrats hold a majority in the Senate only through a tie-breaking vote of Vice President Kamala Harris, so getting that relief bill passed won't be easy.
Without any mental reservation.
New at 4, Kansas Governor Laura Kelly says starting today, the state is expanding its vaccination process into phase 2. That includes first responders, police, and corrections officers, but also grocery store and food service workers. It includes those who work in food processing, such as meatpacking plants. About 1 million Kansas are in phase 2, but the next supply of vaccine only has about 45,000 doses. Each county will decide how to allocate that vaccine. Now, in Johnson County, the health department is holding a Facebook Live tonight at 5:30 to talk about what phase 2 of the vaccine distribution process will look like for the county. And if you would like to watch that, I just retweeted a link to that feed. This afternoon, we are getting a look at just how limited the vaccine supply is in Missouri. And our Michael Mahoney is breaking this story for you. Michael, how bad is it?
Well, Kelly, it's not good. According to officials on a COVID distribution briefing today, Missouri has 178,000 more requests for vaccine doses compared to what they're going to get next week. Now, Missouri expects to get about 38,000 doses of both the Pfizer and the Moderna vaccines each. But in terms of Pfizer, 90 facilities have asked for more than 159,000 doses of Pfizer. So they're about 122,000 over what they are expecting. Now, the same situation applies to the Moderna vaccine. 150 operations are asking for 94,000 Moderna doses, making them short on that by 56,000 compared to what is coming. Now, obviously, they are hoping for the allocations to increase, but they don't know when that may happen. And this is happening just as the state is expanding its vaccination process to people over 65 and to many first responders, placing more pressure on the vaccine supply. And they're also trying to gear up for mass vaccination sites around the state of Missouri. But some public health officials today are now worrying that that plan, the mass vaccinations process, could make the Missouri supply an even tighter situation. Kelly?
Thank you, Michael. Now, earlier this week, Missouri Governor Mike Parson announced the state is activating the National Guard to help plan for mass vaccination clinics. There will be 9 sites across the state. The goal here is to be administering vaccines by the end of the month. The National Guard will also be sending out administrative teams to help with the backlog in reporting. The leaders of Kansas City area health departments are asking residents to be patient with the COVID-19 vaccine rollout. The region's top health leaders issued a statement saying they've seen a high demand from residents for the vaccine. While both Kansas and Missouri have advanced to the next phases in their vaccine distribution plans, supply remains very limited in the region. Frontline healthcare workers, along with residents and staff of long-term care facilities, remain the first priority in the distribution. Now, one of the biggest hospital systems in Kansas City is trying to keep up with the supply challenges of the COVID-19 vaccine. Investigative reporter Matt Fleener explains.
Vaccinations are continuing at St. Luke's Health System, and counting the tally so far.
after today, probably about 12,000 doses.
Greg Teal's in charge of pharmacy services for St. Luke's, saying the rollout within the health system has gone well, but now waits for next steps.
We're just waiting to see, probably from the federal level, what does the Biden plan look like compared to what did the Trump plan look like over the last several weeks.
A new administration trying to bring more doses online, as St. Luke's is working with both Missouri and Kansas on future dose allocations.
Is it going to roll out to community pharmacies, more to health departments? Where do health systems and hospitals fit in? Because I think we all have to be a part of the solution.
As for moving forward, Teal says it's up to all providers to make sure communication stays strong.
I think we're going to need to do a better job of trying to communicate that out, of saying, yes, you are eligible right now because we've opened up to 1B, or the states have opened up to 1B, but you may not be slotted for several weeks until a slot becomes available.
Matt Fleener, KMBC 9 News.
St. Luke says so far it has not had any supplies go to waste. It does suggest being patient, watching social media, and making sure your online patient portal is active. In the University of Kansas health system, employee mass vaccinations are still underway. KU says right now it's waiting on guidance and more vaccine doses to help people outside the hospital. KU would need 10,000 or more doses per week to vaccinate patients in the general public over age 65. Local leaders are joining mayors across the country in urging congressional leaders to approve President Biden's coronavirus relief legislation. KMBC 9's Bianca Beltran is live in Lee Summit now with more on the mayor's request for more federal funds. Bianca?
Well, Kelly, many communities across the country are still incurring costs from the pandemic and expecting more to come with vaccine distribution.
A lot of our citizens and community are still struggling economically.
Bill Baird is among nearly 300 mayors who signed a letter to congressional leaders urging them to approve President Biden's plan for $350 billion in direct federal assistance. Lee Summit received nearly $6 million in CARES Act funds last year. Most of the money went toward public health and economic support.
We reached over 60 businesses that way, but we have thousands of businesses in our community. So and we're still in the middle of this.
Kansas City, Missouri received more than $30 million in CARES Act funding, but city manager Brian Platt says it could not be used to make up for a larger loss in revenues.
This funding for us is critical, that we get some relief here. And if not, we will end up needing to reduce services and consider furloughs and layoffs of our employees.
On top of their current pandemic responses, cities are asking for resources to distribute vaccines on a growing scale.
Once we get a sufficient supply to distribute as many vaccines as we need on a daily basis, it will take additional staffing, it will take additional supplies, it will take coordination with all levels of government to make sure that we're getting that vaccine out there. And that's, of course, significant additional cost for us.
And the city manager said that he would like to see direct aid to cities like Kansas City as opposed to the process for the CARES Act funding, which went through the counties. Reporting in Lee Summit, I'm Bianca Beltran, KMBC 9 News.
City Manager Brian Platt told KMBC Kansas City had a $50 million shortfall this fiscal year and is looking at a possible $70 million budget shortfall next year. Both Kansas and Missouri are releasing new positivity percentages today. In Kansas, there has been a steady decline. It's now at 10.3. The decline continues in Missouri as well. It's now at 12.2. A rapid at-home COVID test being developed at the University of Kansas is getting closer to production. KU professor Dr. Steven Soper and a team of grad students have been working on the saliva-based test since June. They say, unlike PCR tests, it actually tells you if you're contagious because it detects the intact virus particle. The team is preparing to submit the test for emergency use authorizations from the FDA next month.
If those results look very, very good, which I have all intention to believe they will, we'll go into large-scale production. I mean, producing hundreds of thousands of handheld units and millions of chips.
Dr. Soper's team is working with commercial partners to get the tests into production, hopefully by the end of April. They could be in stores by the end of June. The handheld device is a one-time cost of $50, and each test chip would cost about $10. KMBC 9 News is compiling answers to viewer questions about the vaccine on our website. We're also posting state and county specific information on vaccines from local health officials. That includes who will qualify for a vaccine and how and when to sign up. You can find all that information at kmbc.com/vaccine.